Hi, I'm Dr. Brian Kaufman. I'm a family doctor and a CLL patient myself, I'm following up using the medium of Zoom to talk to a friend of mine about the ASCO papers related to CLL. You want to introduce yourself?
Hi, I'm Dr. Matthew Davids. I'm an assistant professor of medicine at Harvard Medical School and the associate director of the Center for Chronic Lymphocytic Leukemia here. And I take care of patients with CLL. I run clinical trials and also a research laboratory focused on CLL.
So we often think of the American Society of Hematology, ASH, as the big meeting for CLL, but there's a lot of important research presented elsewhere, including ASCO, the American Society of Clinical Oncology. Could you comment on that, and was there anything that really caught your interest there?
It is true that I think a lot of the groundbreaking studies do tend to be presented at the ASH meeting, but sometimes we do see important studies coming through for the first time at ASCO. And I think this year, probably the best example of that was the results of the so-called CAPTIVATE study. So just by way of background, as you probably know, ibrutinib and venetoclax are both very active drugs, and we're starting to see a bunch of trials now being reported combining the two. And at the ASH meeting, actually, we'd seen a number of different studies combining these agents, but these were generally smaller phase 2 studies at single institutions, for example, the MD Anderson data set. So I think one of the things that's interesting about the CAPTIVATE study is that it's a larger multi-center phase 2 trial, and it's a sponsored research study from the developers of the drugs. And so it's sort of a different look at a similar combination as what we saw at the ASH meeting, but kind of a larger number of patients and a very robust, albeit a bit early data set.
Was this relapsed and refractory patients?
No, the CAPTIVATE is actually only treatment-naive patients, and patients actually had to be under age 70 at the time of study enrollment. So it's kind of a younger, fitter CLL population in the frontline setting that was looked at there.
So I would suspect that the results would be phenomenal with that combination. Can you share those results? And then I have a couple follow-up questions after that. Yeah.
Yeah, so I mean, certainly the results do look very promising. It's early days, so their follow-up is quite short, but they were looking at 160 odd patients, and really one of the focuses initially in the study was to see if they could reduce the risk of the tumor lysis syndrome issues that we've seen with venetoclax in patients treated with venetoclax monotherapy. So in the CAPTIVATE study, they're giving 3 months of ibrutinib, and they found that the majority of patients were able to reduce their risk of tumor lysis syndrome. And then when they introduced the venetoclax in cycle 4 in combination, they saw almost no issues with tumor lysis at all. And the efficacy data look very good. They reported data from bone marrow biopsies out about a year or so into treatment, and they're seeing that upwards of 80–85% of patients are getting into this MRD undetectable state without the need for chemotherapy. So I think that's a pretty impressive result, albeit with small numbers so far.
Well, yeah, so a couple comments on that. First, we all want MRD. Second, I really appreciate you calling it MRD undetectable instead of MRD negative. I think that's kind of a shift that's happening in the field, and I think it's a more accurate and easier for patients to understand. Is the hope with this, like with some other trials, that this might be a limited duration therapy if we get patients to where they have no detectable disease in their bone marrow, their blood, their lymph nodes have all shrunk, that they might be able to stop all therapy?
Yeah, that's the goal, and I think particularly for the younger patients, that's a really important goal since they have hopefully a very long time to live and they don't necessarily need to be on therapy that entire time. So the CAPTIVATE study is interesting because it actually has a couple of different cohorts, and what they reported at the ASCO meeting was an MRD discontinuation strategy cohort, where based on their final assessment after that year plus of therapy, patients who are undetectable for MRD can actually discontinue therapy, and that's randomized to patients continuing on with therapy. What they haven't reported yet is they actually, I believe, have a fixed duration cohort as well that'll get a certain amount of time-limited therapy, and then irrespective of MRD status would discontinue. And so we're still waiting to see some of the initial results from that cohort.
All right, any final thoughts on the CAPTIVATE trial or other things from ASCO that you wanted to share?
I think just really, we're going to need to see longer follow-up. That's kind of been a theme with a lot of the studies in CLL lately. We've seen these really promising initial reports of a small number of patients, and it's going to be important to do our due diligence to continue to follow these patients and make sure they're continuing to do well. And I think we will see that going forward. I'm certainly very optimistic about the longer-term results of these studies.
Yeah, I'm totally with you there. I think the thing that excites me, there's a lot of things about this trial. The first is that it's combination. The second is that it's a non-chemo combination. The third is we're looking at how predictable MRD undetectability is. is that a valuable surrogate marker? And the fourth, what you mentioned, is that it's a potentially a fixed duration therapy. All of those would really improve the life of a CLL patient. So thanks very much, and we will talk more. Thank you. I always learn something talking from you, Dr. David. Thanks.
Sounds good. It's my pleasure, Brian.
Thanks.